Good afternoon, ladies and gentlemen. Thank you for a nice introduction, Mr. Chairman. I'd like to thank the organizing committee for giving me a chance to speak on this wonderful meeting. Today, my presentation is regarding on our evolving role for yttrium-90 regional hepatic therapy for colorectal liver metastatic disease. As we know, treatment options for metastatic colorectal cancer for involving the liver, the surgical resection and the palliative systemic chemotherapy. At present, we are recognizing the improvement of chemotherapy such as survival up to 25 months nowadays to compare survival of 6 to 8 months 50 years ago using 5FU. This slide shows the changing landscape in the first line treatment of metastatic colorectal cancer. You can see the significant progress has been made in the treatment of metastatic colorectal cancer over the recent decades, but more work needs to be done to determine optimal combination and the sequencing of a new anti-cancer drug. Why radioembolization? We know that limited number of patients for resection of colorectal cancer metastasis to the liver, and limited efficacy of chemotherapy showing very high recurrence rate in hepatic metastasis, and limited tolerance to multi-sequential chemotherapy due to additive toxicities. But we have to know now potential of radiotherapy as a primary effectiveness of radiation, chemosensibilization, and radiosensibilization. Y90 resin microspheres has physical characteristics such as 35 micron in diameter, pure beta ray, 0.93 MeV in activity, 64 hours in half-life, and penetration 2.5 millimeter mean and 11 millimeter in maximum. Transarterial radioembolization has both radiation and embolization effect occurred by implanted microspheres into small calibered tumor vessels. And you can see the most of yttrium-90 microspheres are flowing into hypervascular tumor bed through selective hepatic arterial branches. There are primary and secondary liver cancers as indication for Y90. As we know, the most of secondary liver cancer are from colorectal, and the remaining metastasis from pancreatic and neuroendocrine tumors, breast, pancreatic, and gastric cancer, etc. For transarterial radioembolization on resectable colorectal liver metastasis, as determined by tumor burden, should be confirmed by tumor staging and pre-treatment diagnostic hepatic angiogram, such as liver dominant disease without central nervous system metastasis, life expectancy more than 3 months, ability to coil embolize gastroduodenal artery and right gastric artery, and long shunt, less than 20%, on technetium-99m MAA study. In patient factors, adequate liver function should be 2.0 milligram deciliter in total bilirubin and more than 3 gram deciliter in serum albumin. I'd like to introduce a summary of a randomizing and controlled trial result as the first line therapy. The first RCT paper was FDA pivotal study, and as a first-line treatment, and the third was administered by an implantable prod. And 34 treated with intrahepatic FUDL versus 36 treated with a third plus FUDL were randomized. The result of first RCT paper was that third and intrahepatic FUDL group showed longer survivors, second and 3-year survivors, and longer TTP than those of group treated with the single only intrahepatic FUDL group. And this second RCT paper as a same first-line treatment shows randomization between 10 treated with the systemic 5-FU leucovorin versus 11 treated with the third plus systemic 5-FU leucovorin. The result of this paper also revealed markedly longer TTP and survivors in third 5-FU leucovorin group than only 5-FU leucovorin group. And I'd like to introduce role of spheres, microspheres, in chemo-refractory colorectal liver metastasis. In patients with chemo-refractory colorectal liver mets, Y90 microspheres significantly improves survival than best supportive care in 2 different studies by Dr. Bester and Seiden Sticker et al. And Bester et al. Retrospectively compared patients who received Y90 microspheres with those receiving just best supportive care. Significant survival advantage was conferred on those receiving Y90 microspheres. Handlis et al. Reported randomized control trial in refractory patient. In patients with chemorefractory colorectal liver metastasis, spheres, microspheres significantly prolongs time to liver progression. And you can see more than doubles the time taken for liver tumors to progress in a randomized control study. And treatment with the 5-FU, spheres, microspheres was well tolerated without serious or life-threatening event. Grade 3 to 4 events were reported in 9 patients in 5-FU only arm compared to 1 patient receiving third plus 5-FU. I'd like to introduce ongoing randomizing control trials for Y90 microspheres in first-line treatment. Many clinical trials in metastatic colorectal cancer are currently ongoing, such as the Surplus trial, Foxfire trial, and the Foxfire Global. In Surplus study, 533 patient recruitment were completely enrolled on April 2013. Foxfire trial and Foxfire Global overall survival in combination with Surplus are still ongoing. Their endpoint is overall survival of more than 1,020 patients. Korea will join Foxfire Global in 2014 as well. I'd like to introduce one case of first-line treatment with Y90 and FOLFOX. This 64-year-old female had both sigmoid cancer and multiple metastatic lesions on both liver lobes, less than 10 centimeters in each diameter. You can see hypervascular lesions, whole liver with variable size tumor. Initial PET exam shows multiple hot focus in both liver lobes, but the follow-up PET 3 months later after TRE shows disappearance of hot spot to compare with previous study. On sequential axial CT shows a markedly decreased size of previous lesions and some calcified change in this area. And also markedly decreased level CEA and normalized CA level after transarterial radioembolization within 4 months. This patient was chemo-refractory and failed to previous RFA on segment 7 metastatic nodule. After TRE for right lobe, tumor is markedly decreased in size and compensated hypertrophy in left lobe on 2 months follow-up CT. You can see this slide discloses multiple black resin microspheres and the remaining tumors cells in part on rejected specimen. But 4-year follow-up CT shows more increased left lobe volume with still normal CEA level. In conclusion, we need to know Y90 radioembolization has interdisciplinary and multi-modality treatment concept. And also this treatment has valuable palliative treatment option in highly selected patients and promising response and survival data for metastatic lesions and acceptable toxicity profile. But we don't know yet where radioembolization should be used in treatment of paradigm of liver metastasis from various tumors. Thank you for your attention.